So now we come to Greek medicine. This is the title page of Marco Aurelio Severio, and the snake you will see in here is something that you will often see over here in even today's demonstration and of in logos and like signs and signals that signify medicine. The snakes here symbolize rejuvenation and healing to many ancient Mediterranean cultures, and in this space the single snake staff of Asilphus and the double snake staff of Claudius appear with other ancient medical images involving snakes. So snakes had a role. Why? Must be an interesting dive. We will talk about it later because we just have to get through this. This is interesting stuff, but I would want you to pursue like a lot of your interest on your own as well. So we come to Hippocrates. So this guy was known to be the father of rational medicine. He rejected superstition, viewed disease as a natural process and not as a divine punishment. He introduced systematic observation and prognosis. The core method was to observe everything, study the patient more than the disease, and the reasoning was empirical based recognition. Now, he developed this theory called the Hippocratic theory, wherein previously people would believe that if someone falls sick, it's basically oh, God has punished me. But the Hippocratic theory shifted that towards being from supernatural to being natural. That explanations there are natural explanations towards illnesses, which may be due to imbalances, environment, and habits, and are not necessarily due to punishments by God. And the observation over the supervision was that you need to listen to the patient and watch the body. He was one of the first people to systematically record symptoms. If you go back and you read a lot of like descriptions of symptoms on Wikipedia and stuff, you'll find that the earliest ones we have is from Hippocrates and people from that era. It's crazy. Yeah, Danish, it's crazy. Old people have written old things. So wonderful, lovely. So detailed case notes, as I said, they're like he was one of the first people to do that, and he put a lot of emphasis on pattern recognition. And this is the earliest version of what we call clinical reasoning. So the main idea was look, listen, and reason, and not invoke the gods because they're busy. The Hippocratic Oath. This is the part over here is a fragment of the oath from the 3rd century papyrus. So beautiful that we still have it going on, like even in my medical school when I was graduating, they had us read this through, of course a modified version. So the Hippocratic Oath, I will not read it through, because it will take a lot of time, is a patient first confidentiality and non-maleficence based dialogue where you want to do what is the best for patient while making sure that you don't harm them, and that is done in the confidentiality.